So many people are talking about expansion today. What type of expansion do we want to do? A, lateral expansion to widen. B, forward expansion to get advancement of the maxilla and mandible. C, both. Watch this clip.
Do you find that the improvement in breathing and airway shown with DICE, with maxillary expansion, comes from the change of the muscles attached to the heart tissue or the improvement of the space for the tongue?
You know, fortunately, there's no wrong answer there because they are related, right? They're related. So because the tongue is the muscle as well, and then all the other muscles. I will say that you know, people always say, well, you know, if you expand the maxilla and then so the airway expands, and so when you see the expansion, say even during DICE, that's what it is. And I'm going to say that's not possible because first of all, for you to physically dilate the pharyngeal muscle wall, okay, you need an advancement, and that's just anatomy, and we can go into that forever.
That was Dr. Stanley Liu. As chair of the Breathe and Sleep Wellness Center, Dr. Stanley Liu is one of the world's foremost authorities in airway and jaw development. With dual degrees in medicine and dentistry and advanced surgical training at Stanford, his pioneering work has transformed how we treat obstructive sleep apnea. Dr. Liu emphasizes the importance of forward maxillary development, reshaping narrow high arch palates to expand the airway and restore proper nasal breathing. The patient that has severe crowding, underdeveloped jaws, we can see his lower jaws rolled back. He has underdeveloped jaws. We can see lots of crowding, all of his teeth angling in, super crowded in the lower anterior, lower incisors coming in behind other lower incisors. His permanent lateral incisors do not have room to come in. His canines are going to be very, very crowded down the road. So he's severely compromised. He needs jaw development in a big way. So first we start to develop him out forward, getting more space, starting to get that maxilla a little bit more forward. Severe crowding down here still. We want to increase the width to widen them out. So we're making room for these lower incisors to come in, widening out this lower arch. The upper arch is still narrow. We've mostly been focusing on advancement. We want to get some width and advancement of that maxilla, both. Here's a patient who is in a similar situation. Very crowded, lower incisors coming in behind. No room for the permanent laterals. So this is almost exactly identical to the previous case we just saw. Lower jaw rolling back and in, underdeveloped jaw structures. Here's his upper. This is where we develop him forward, making lots of room, also widening him, but plenty of room for his permanent teeth to come in later. And on his lower, we widen this out to give plenty of room to straighten up these lower incisors and give a nice wide broad arch. And here he is, lower jaw set back to more forward lower jaws. What we want is we want the chin at or in front of the bridge of the nose. We see right here his chin is definitely behind the bridge of the nose. Right here it's closer to or even with the bridge of the nose. So very good forward development of both jaws. Here's another case. High nose lip angle, flat lip, jaws inset, smaller lower jaw. Getting these jaws forward, smaller nose lip angle, fuller lips here, stronger lower jaw. You can see this in more, forward more, getting that forward advancement of the maxilla and the mandible. Here's another one. Higher nose lip angle to a smaller nose lip angle. Jaws rolling back, jaws kind of more forward with the bridge of the nose here. Jaw set back. She was told she needed jaw surgery to surgically move her lower jaw forward. With our Airway Center appliances treatment, we developed both of her jaws forward, advancing the mandible, non-surgical. Great result, and she did not need surgery. There's another one, lower jaw rolling back here. We get the mandible advancing forward, much better jaw structure. We have our airway before treatment right here, 5 millimeters by 14 millimeters. We can widen this 10 millimeters and make this 24. Getting the advancement forward helps us go from 5 to 10, massively increasing and improving her airway. This is her airway volume, 7,000 to 10,000. Minimum smallest constriction going from 64, more than doubling to 164. Behind her tongue, very, very small in the black zone to getting in the red zone and yellow zone. This is another patient, severe crowding, and she has her premolars coming in. These canines are blocked out, very small mouth. We widen, we advance the maxilla, open this all up. We give her an airway that goes 23 millimeters in width to 33. With her advancement, we're going front to back 7 to 16, front to back, more than double, increasing her airway and breathing space. This is her airway volume right here. She starts out in the red and yellow, and she goes to the yellow and the green. Much better airway space, 17,000 to 29,000. Her smallest constriction, 115 to 251. Okay, if it was you, would you rather be breathing through this or through this? Would you want your spouse snoring, breathing through this, or quietly breathing through this, not waking you up?
For you to physically dilate the pharyngeal muscle wall, okay, you need an advancement. And that's just anatomy, and we can go into that forever.
Dr. Liu again emphasizes the importance of forward advancement of both jaws. What we're doing is advancing the maxilla, advancing the mandible, getting width of the maxilla and mandible. Going back to that first patient that we had, we want to advance, get both jaws developing forward, as well as get his width.